I'm Michelle McCarty, and I'm going to talk to you about HIV, human immunodeficiency virus. It is a virus that attacks, weakens, and will eventually destroy your immune system. It is no longer considered an automatic death sentence. In fact, it is considered a chronic illness that's treatable through modern medicine. Despite education on prevention, HIV still continues to plague our world. The disease is not curable, it is only treatable, and most oftentimes it is preventable. HIV has evolved over the past 30 years and making some strains of it resistant to modern medication and treatment. Educating society and local communities on risk factors and the importance of HIV screenings can help to reduce the occurrence of HIV. Early diagnosis and treatment can help prevent the spread of HIV as well. Human immunodeficiency virus, or HIV, is identified as a lentivirus, a member of the retrovirus family that causes acquired immunodeficiency syndrome, or as we know it, AIDS. Lentiviruses are responsible for long-duration illnesses and very long incubation periods. It is a virus that attacks the immune system, weakening it and putting people who are infected with HIV at risk for opportunistic infections such as PCP pneumonia or pneumocystis pneumonia and Kaposi sarcoma, which is a type of skin cancer that is a result of a virus. The HIV virus was first discovered in the United States in 1981. HIV was initially identified and predominant in homosexual males and IV drug users at this time. Evidence shows that HIV originated in chimpanzees overseas and was classified then as simian immunodeficiency virus, or SIV. Humans became infected through zoonosis, or the transmission of a disease from animal to human. Research shows evidence that humans contracted the illness from SIV-infected chimpanzees by coming into direct contact with their blood, by eating their meat, being scratched or bitten by the animal. Once SIV entered the human host, it evolved into what we know today as HIV in humans. HIV has become a worldwide pandemic. The Centers for Disease Control and Prevention estimates that there are over 40.3 million people in the world who have HIV. The highest concentrations of HIV is noted to be in sub-Saharan Africa, with approximately 4.8% of the population having the virus. It is also estimated that approximately 1.3 million people are currently infected with HIV in the United States alone, and 27% of those people don't even know they have the disease. 23 million people have died from HIV worldwide since the initial discovery of the disease in 1981. Approximately 56,000 persons in the United States are newly infected with HIV each year. This equals nearly one new infection every 9.5 minutes. According to the CDC, there have been 2,496 HIV cases reported in West Virginia since 1989, when HIV by law was mandated as a reportable infectious disease. 371 of these were reported from District 1, which includes Mercer County. 92 new cases of HIV were reported to the CDC in 2011 in the state of West Virginia. HIV, strangely enough, is not a very infectious disease. The virus is never transmitted by casual contact between an infected person and uninfected persons. HIV is not transmitted in saliva, spit, sweat, air, water, or by objects that have been used by an HIV-infected person. This includes hairbrushes, combs, silverware, inanimate objects that we use every day. However, anyone of any age, race, sex, or sexual orientation can be infected with the HIV virus. But you are at greatest risk of having HIV, or contracting HIV rather, if you have unprotected sex of any nature, have another sexually transmitted infection, use intravenous drugs, or are an uncircumcised male. Another risk factor that is prevalent is an HIV-positive mother transmitting the disease to her unborn child. Other less common risk factors include being stuck with an HIV-contaminated needle or other sharp object, and this mainly applies to those who work in the healthcare system. Eating food that has been chewed by an HIV-infected person, having been bitten by an HIV person, French kissing, tattooing, or body piercings. Anyone who is sexually active or uses IV drugs is at risk for contracting HIV. Target populations that are most severely affected by HIV are gay, bisexual men of all races and ethnicities. Heterosexual and IV drug users are another targeted population. Blacks have a higher incidence than other races and ethnicities, followed by Hispanics. Diagnosis is confirmed by HIV testing, which can be done using blood, urine, or oral secretions. Blood testing is the most accurate. EIA, enzyme immunoassay, used on venous blood is the most common test used and can be used on oral fluids, not saliva, but oral fluids, and urine. The secretions are analyzed for antibodies to HIV. The test is typically resulted in 1 to 2 weeks. However, there are rapid HIV tests that can be resulted in 5 to 30 minutes. There are also at-home HIV testing kits, but these tests have been found to not be accurate or consistently accurate. A lot of times they'll show a false negative result, which means that the person does have the disease, but they tested negative. Testing can be anonymous, where the patient is given a number or an alias, or it can be confidential, where the patient's name is attached to a medical file and discussed or disclosed only with that person. It is not recommended that everyone get tested for HIV, but certainly those who are or who have high risk factors to the disease. During the primary infection, flu-like symptoms may occur 1 to 2 months after the virus enters the body or exposure. These symptoms include, but are not limited to, fever, muscle aches, sore throat, headache, swollen lymph nodes, joint pain, night sweats, and diarrhea. These symptoms can be mild to severe, but often subside after a few weeks. During the primary infection, the HIV viral load is extremely high. The majority of people do not know they have HIV during this time. The next stage of infection is the clinical latent infection. During this stage, there are no specific signs or symptoms. However, the lymph nodes may remain enlarged or swollen. Clinical latent infection lasts 8 to 10 years, maybe longer, maybe shorter depending on early diagnosis and clinical treatment. Early symptomatic HIV infection is the next phase identified and has many of the same symptoms from the primary infection present, in addition to weight loss, diarrhea, cough, and shortness of breath. The last phase is known as progression to AIDS, where the immune system is pretty much completely wiped out by the virus. There is absolutely no cure for HIV. There have been many advances in modern medicine in regards to treating HIV, however. The virus is now considered a treatable chronic illness, and persons infected can live for decades. The treatment goal for HIV is to reduce the replication of the HIV virus and decrease the viral load present in the blood plasma by using antiretroviral medication. Typically 3 drugs of 2 different classes are used for treatment. This is also known as combination drug therapy. Research shows that HIV-infected persons with an undetectable viral load are less infectious and are less likely to transmit the HIV virus via sexual contact. People are living longer and healthier lives with HIV because of successful combination antiretroviral therapy. Consistent and proper treatment reduces the viral replication and reduces the HIV blood plasma concentrations to levels below detection, thereby maintaining the integrity of the immune system. Suppressing the virus may help decrease the risk of transmission during sex. Concentrations of HIV in blood plasma may represent the concentration of HIV virus in semen and vaginal secretions too. Studies have found that HIV treatment related beliefs influence risk behaviors in those both HIV positive and those who are not positive. There has been evidence that HIV persons are less cautious sexually when they have an undetectable viral load, and non-HIV persons are less cautious when their sexual partners have an undetectable viral load too. HIV is treatable, but treatment complications can occur. HIV medications have negative side effects, increasing a person's need for additional medication. Another risk is for therapy is developing drug-resistant HIV, where the virus stops responding to drug therapy and advancing into AIDS rapidly. HIV can be prevented. Limiting risk factors can prevent HIV infection. One way to prevent the spread of HIV for a person at high risk for having the virus to know their HIV status by getting tested. Safe sexual practices by using a condom, by using a condom and a dental dam for vaginal, anal, or oral sex are other preventative measures for reducing the risk of contracting HIV. Prevention for intravenous drug users can be achieved by not sharing dirty needles. Although abstinence is a sure way to reduce the risk of contracting HIV, limiting sexual partners may reduce your risk as well. Nurses play a vital role in controlling communicable diseases through primary prevention. Unfortunately, there is not an HIV immunization, but nurses can focus on educating the community on HIV prevention measures, such as safe sexual practices, encouraging IV drug users to not use dirty needles, and even locating a needle exchange program can be effective in primary prevention to reduce the spread of HIV. There are only 146 needle exchange programs in the United States at this time. These programs are controversial, but have proven effective in reducing bloodborne infections. For HIV, another key element that focuses on healthcare workers is encouraging and educating the importance of utilizing universal precautions at all times. When educating the community on primary prevention of HIV, the nurse should focus on abstinence, limiting sexual partners using condoms and other devices for foreplay, and avoiding sexual contact with someone that you know is HIV positive. Another step in communicable disease prevention is identifying as secondary prevention. The nurse's goal in secondary prevention in HIV is early detection and clinical treatment of the infected individual. This has a positive influence on decreasing the spread of HIV by promoting behavioral changes, early clinical treatment, encouraging partner notification, protecting blood supply, and decreasing transplacental transmission. HIV screening is done on a voluntary basis, however, in most states and environments. HIV screening is a confidential testing process, though. Tertiary prevention is not often implemented in community health nursing. However, HIV is a lifelong disease that requires long-term needs because there is no cure. HIV positive test is only the beginning of a lifelong battle. Interventions include encouraging follow-up care, monitoring compliance of taking their prescribed antiretroviral medications, and ensuring routine lab work is drawn to measure the viral load to measure effectiveness of the treatment regimen. HIV is a chronic illness that often leads to death. HIV is also a preventable illness. The community health nurse and all nurses have a responsibility to educate the public on ways to prevent HIV transmission. By educating the public on prevention measures and promoting screenings for early diagnosis, nurses can help to eliminate the rapid spread of HIV. Identifying resources for those who are at high risk of contracting HIV to get tested and seek clinical treatment are an important role of the community health nurse as well. HIV has been around for 4 decades now that we are aware of, and the disease will be around for many years, so we all need to be doing what we can do possibly to educate people. Thank you.